In our previous mini lecture, we learned about stress, what the stress response is, and how this can impact our health. In this mini lecture, we'll focus on stress management techniques. More specifically, we'll consider relaxation, mindfulness, meditation, exercise, altering your outlook on stress, as well as a few other approaches to managing stress in our day-to-day lives. First of all, though, let's just be reminded of what the problem is in the first place. So we do need some stress in our lives. If we had no stress in our lives, we'd never get anything done. In fact, we need some stress in order to perform optimally. The problem, however, comes when we have too much stress. That can ultimately lead to burnout and breakdown and a number of chronic diseases. And this is what we focused on in our last mini lecture. Now, in terms of managing stress or preventing us from, suffering the impacts of too much stress, there are a number of stress management techniques available. And these can be considered either adaptive or maladaptive. So, stress management techniques that are considered adaptive are those that can reduce stress as well as give benefits to the individual, as opposed to maladaptive stress management techniques like that which you see in the picture on the slide, whereby someone may use food, for example, to deal with stress. Now, this might help the person feel a little bit better, at least in the immediate sense, but certainly this is not an adaptive way to respond to stress, because while eating that piece of cake might make you feel a little bit better at that moment in time, there are other negative health consequences associated with eating that cake. For example, the effect on, say, cholesterol levels and our weight, for example. So what we're going to be considering in this mini lecture is just the adaptive approaches to stress management. The first stress management technique I'd like to cover is relaxation. So in our last lecture, we talked about stress and the stress response. Relaxation, on the other hand, can be considered the physiological and psychological opposite of stress. In other words, while the stress response causes an increase in our heart rate, an increase in our breathing rate, an increase in metabolism, oxygen consumption, blood pressure, and so on, when we're relaxed, we experience the opposite. And I'm sure you can all relate to this. I'm sure you all can understand that when you're relaxed, you get a drop in your heart rate, your breathing rate is lowered, your blood pressure is lowered, your overall oxygen consumption and rate of metabolism is lowered. So in that sense, relaxation really is the physiological and psychological opposite of stress and the stress response. Now, actually achieving relaxation can be done in a number of different ways. So specifically, relaxation or the relaxation response, whereby you get that decrease in heart rate, decrease in breathing rate, and so on, can be achieved through techniques like visualization, progressive muscle relaxation, which is a technique whereby you sequentially tense and then relax different muscle groups in the body in order to sort of highlight what relaxation should feel like as opposed to muscular tension. You've then got various breathing techniques, which can also be really helpful to elicit relaxation and especially slow the breathing rate down. Some people use meditation to elicit relaxation. And then there's other techniques such as Tai Chi. And look, the list I've given you here is certainly not exhaustive. I'm sure you can all think of at least one or two extra ways by which relaxation can be achieved. The thing that all these techniques have in common, though, are four key components. So there are four key components to eliciting the relaxation response, which is that drop in heart rate, breathing rate, and so on. So the first of these components is having a mental focus. And, in those activities I mentioned, like visualization or Tai Chi or meditation, there is that component of a mental focus. Component number 2 is having a non-judgmental attitude. So not judging yourself, judging your thoughts, and so on. Component number 3 is being able to achieve a decrease in muscular tone. And progressive muscle relaxation, which I mentioned on the last slide, would be an example of a technique that specifically hones in on that third component. The fourth necessary component in order to elicit the relaxation response is a quiet environment. And look, these 4 components are important to keep in mind because, while you might think that, sitting on the couch, for example, is relaxing, which, look, it may be to some extent, if you want to actually achieve physiological and psychological relaxation or get that relaxation response, the 4 components that you see here must be present. So that's relaxation. Now, the next 2 techniques that I'm going to mention, mindfulness and meditation, they're closely related to relaxation, but there are also some important differences to keep in mind. So mindfulness is something that some of you may have heard of. It's a bit of a buzz going around at the moment. There's quite a bit of research and attention going into mindfulness and the potential benefits for our health. So mindfulness is all about bringing your attention to the present moment and trying to be fully present and aware of where you are and what you're doing. So not ruminating or thinking about the past or not stressing about what's to come in the future, just focusing on and thinking about the here and now, where you physically are and what you're doing at that time. And there's a growing body of research suggesting that mindfulness, or this way of thinking and being, can be quite helpful for stress management. Then you've got meditation. And look, like mindfulness, there's a whole lot to meditation that we don't have time to cover or go into detail today. All I will say is that there are lots of different ways to meditate, lots of different specific techniques of meditation, but what you might say all these approaches have in common is the idea of trying to rest the mind, calm the thoughts, while still being fully awake and alert. And that's often a bit of a misconception with meditation. People think it's about sort of going off for a snooze and not necessarily being awake and alert, but meditation is very much about being awake and alert, but while calming the minds and the mind and the thoughts that often race through our heads at 100 miles per hour. Now, the previous 3 techniques I've mentioned, relaxation, mindfulness and meditation, they've all been shown to have benefits in terms of stress management. We now come to a more active technique of stress management, and that is exercise. So studies have shown time and time again that both acute or a one-off bout of exercise, as well as regular participation in exercise, can help reduce our perception of stress, so how stressed we feel we are. In addition to this psychological side of things, exercise also seems to be able to dampen the physical or physiological responses to stress. So for example, it's been shown that people that regularly exercise, they have a lower blood pressure response to stress. So that stress response that we learnt about in our previous mini lecture involves a rise in blood pressure. However, people that exercise regularly don't get as great a rise in blood pressure. Now that's, in relation to the chronic or the effect of regular exercise, but studies have also shown that a one-off bout of exercise can also dampen the blood pressure response to subsequent stress. Then you've got the additional benefits that you get from exercise, not necessarily specifically relating to stress per se in the psychological or physiological sense, but the fact that exercise just generally enhances your psychological and well-being and mood is obviously important for stress management. Another technique that is growing in research interest is thinking about how we consider stress. So what's our perception of stress? What's our outlook on stress? And I'm actually going to include a YouTube link for you guys to have a look at after this lecture for anyone that's interested. And it's all about some research that's been done that shows that if you don't see stress as the bad guy, so if you don't see stress as a bad thing, that can actually be beneficial for health. Maybe if I put it the other way around, if you see stress as a good thing, that can mean you will have less harm or impact on your health as a result of stress. And this is a really interesting concept, which, as I said, I'm not going to go into detail in this specific mini lecture, but I strongly suggest that you see the TED Talk that I'm going to include as a link, which goes into detail about the research in this area, because I actually think everyone can benefit from knowing about this concept of altering your outlook on stress, not necessarily viewing stress as a bad thing. Other than the specific techniques I've mentioned, there are, a number of ways that when combined can help reduce our stress or help us manage our stress. So I'm sure we can all appreciate that we cope better with stress when we look after ourselves. So when we have a good diet, regular meals, when we have people around us that we can talk to and that care about us. So when we have good social support. Unfortunately, when we're stressed, one of the first things that goes out the window is our sleep. So if you can practice good sleep hygiene and get more sleep, that can be helpful for managing stress. When we're tired and grumpy, that certainly doesn't help us in terms of managing our stress. And one final thing to consider is, the way that you think about the things in your life. And sometimes there are things that happen to us that we just can't control. And sometimes simply accepting that we can't control everything can help with managing stress. So just to summarize what we've talked about in this mini lecture, we've covered a number of stress management techniques, including relaxation, mindfulness, meditation, as well as exercise. I've touched briefly on how altering your outlook on stress can have an impact on how that stress might affect your health, and we've mentioned a couple of other approaches. So what I leave you guys to do now is have a look at the YouTube link that I'm going to include so you can learn a bit more about how to alter your outlook on stress.